Hi, I'm Dr. Tom Schuler. I'm a spinal surgeon. Today, we are going to show you some simple stretches that you can do every day to reduce your neck tension and stiffness. I see many patients with neck discomfort, not from injuries, but from long hours sitting, working at desks, and looking at screens. Over time, this posture places extra strain on the neck and the upper spine. The good news is, gentle, consistent movement can help relieve tension. It's important to note while you're doing these exercises that if any of them are causing you significant pain, then you should avoid those and get examined. But as long as you're having no pain or minimal discomfort, then you can go through the range of motions and learn from what we're showing you today. These stretches can be done sitting or standing, whatever feels most comfortable. I recommend doing them 2 to 3 times a day. Move slowly, stay comfortable, never force a stretch, and let's get started. The first stretch is called a chin tuck. This targets the muscles at the base of the skull, and these muscles get strained because of all the reading phones and using computers, and our head's in a forward flex position. So we need to work on getting our head back. So we're going to extend our head over our shoulders by gliding it back and then bringing it forward. And we're going to repeat that 20 to 30 times to try to get this motion to be a more normal gliding motion and less painful. Next is the upper trapezius stretch. The trapezius muscle extends from the shoulder up to the neck, and this gets tight very often because of all the forward flexed things we do during the day, especially on our cell phone, computers, just looking down. So what we need to do is work on this extension of these muscles to help support the neck. So the way we do that is we tilt our head back and to the side. We can always use our hand to help a little bit, but we don't want to force it. We want to relax this shoulder, and we want to hold that for 20 seconds and then go to the opposite side and hold that for 20 seconds. And repeat that 3 times to work on mobilizing these posterior muscles that help us stand upright and maintain our posture. We can do this either sitting or standing. Our next stretch targets the muscle in the back of the neck called the levator scapulae. The way we do this is we flex our head forward with our chin rotated a little bit and our nose pointing towards the armpit, and we hold that for 20 seconds, come back to neutral, then we go to the opposite side, hold that for 20 seconds. And we try to do this 3 times on each side to release those muscles in the back that are constantly firing because of all the forward flex activities we do. Our final stretch is rotation, and that's turning the head all the way to the side and then back to the other side, nice and slowly holding it, repeating that for 15 seconds each direction, doing it 3 times. And this is important so that we maintain that motion of trying to keep our ability to look over our shoulders, see cars coming if we're driving, and keeping ourselves out of trouble. I recommend doing these stretches 2 to 3 times per day, especially if you sit or work at a desk. If the neck pain continues or gets worse or travels down your arm, please speak with a healthcare professional. For more safe spine movement tips and education, visit the National Spine Health Foundation at spinehealth.org.